Hello, and welcome to Arborist Rescue for First Responders. This vector rescue program was designed in collaboration with Emmons Tree and Symmetry Care in early 2020. We set out to design a program that would prepare first responders for arborist and person and tree emergencies using the equipment they already had with techniques slightly modified from what they may have learned in operations or technician level programs. As we go through this, please write down any questions you may have so on practical day we can go through those. If you happen to stumble across this presentation and you're not signed up for one of our in-person programs, please keep in mind that this presentation is designed to supplement in-person hands-on instruction and is not training in and of itself. On our first day, we're going to go over introductions and get some background on everybody. So some of the things we'd like you to keep in mind as we get closer to the program is think about kind of perceived challenges that you might have when responding to an arborist emergency. Anything personally or within your team, whether it's equipment or training or techniques, and we'll try to integrate any specific issues you might have into the training course. At the conclusion of this program, we hope that you will be able to identify common challenges faced by fire departments performing an arborist rescue, describe common medical considerations related to arborist rescue or person and tree emergencies, describe common arborist emergencies and the rate of incidents, identify hazards common to arborist work sites, identify common arborist climbing equipment, identify common arborist anchors and climbing systems, and describe the incident command structure and incident action plan components. When we talk about the need for this class, it pretty much boils down to the hazard that exists in all of our jurisdictions. If you drive around your jurisdiction, most times of the year, I guarantee you'll see commercial tree operations doing line clearing for Eversource, commercial operations doing residential work, commercial operations doing kind of big takedowns for municipalities, and kind of fly-by-night arborists with magnets on their pickup truck that do masonry, landscape, and tree takedowns. Any jurisdiction out there that has trees has this hazard. There's a huge disparity in rescue times, unfortunately, when it comes to fire departments responding to these incidents. There's no kind of national average on this. There are high-functioning teams that train on this all the time that can execute rescues fairly efficiently. But there are case studies we have reviewed where victims have remained in trees and ultimately perished in excess of 4 hours waiting for rescue. Certainly, like most other technical rescue incidents, this is a high-risk, low-frequency event, meaning the consequences of the event are very, very high for both us and the person in distress, and it doesn't happen very often. When you take incident safety officer, instructor, and lots of other kind of fire department programs, when we look at that risk frequency matrix, these are the types of events that we really should be training on most because we get the least amount of reps in the real world, and the consequences of failure could be fatal. Last but certainly not least, all of the skills required to perform an arborist rescue are job performance requirements of rope technicians. And while it's not something we do every day, the ability to kind of move freely on natural or man-made objects is a rope technician JPR. The ability to move freely up and down fixed vertical lines is a rope technician JPR. And the ability to pick somebody off clinging or stranded on both natural and man-made features is a rope technician JPR. Trees certainly are natural features, and we hope that by the end of this program, you'll be able to correlate a lot of the technician JPRs that you learned in school to a tree. They are very, very similar with a few modifications needed. The kind of inherent challenges that we talk about that most fire departments face is accessibility is usually the biggest one. Most fire departments and tech rescue teams will show up to a person in tree or arborist emergency, and plan A is always a ladder, whether it's an aerial device or a ground ladder. And we can get very, very focused on making that aerial device work for us if the person's out of reach of a ground ladder, almost to a fault. We'll get tunnel vision on it and spend 15, 20, 30, 45 minutes doing 16K turns trying to get our turntable in position where we can actually reach with our ladder truck. Meanwhile, the patient is either bleeding out or becoming hypoxic up in a tree. So we can't get focused on plan A all the time. You need somebody in your team who's working on plan B, plan C, plan D as the operation is unfolding. And you need to have kind of the wherewithal to understand if plan A isn't going to work and you know that right away, you need to be ready to pivot and move on. So that's a huge challenge faced by most fire departments, is because we don't train on this a lot. We kind of stick to what we know. The other kind of big one is these are bottom-up rescues, which is not typical for most fire departments, meaning our victim is elevated above us and we need to get up to them and remove them. Vertical mobility techniques are the ability to kind of move freely up and down fixed vertical lines. As I mentioned, those are a rope technician job performance requirement, but they're not typically emphasized both in traditional rope technician programs, much less back in your fire department, where most everything is team-based. Some of the other ones that we kind of deal with are just unfamiliarity with arborist climbing techniques and equipment. Some of the stuff should be familiar to you when you see it. A lot of it might be foreign. And the way they move around on rope and the way they move around in a tree is very different from what we're used to in our world. And there's a lot of unknown and unfamiliar hazards at work sites that we might not even be aware of that they're dealing with. So as a quick refresher, traditional fire department pickoffs as taught in rope technician typically are performed from the top down. These are typically team-based, meaning a rescuer is attached to two terminal ends of a main and a backup or a twin tension system. They're lowered down to the victim. All they have to do is make the hookups. They might use a set of fours to kind of lift the victim off of their system, but they're not running the kind of main system. The team up top is hauling and lowering them. The anchors we use to kind of design and construct our system are easily inspected by us. Usually they're at the top, and usually they're familiar. Even if we're not using rated anchors in a training facility, we're using fire trucks, big trees, things that we've trained on a lot and we're familiar with and can kind of give a ballpark, beyond question on them. The victims kind of are either attached to another system or not, so supported or unsupported. They might be clinging on something, stuck on a ladder. They might have a lanyard or a fall arrest system in place. But that's kind of how most fire department pickoffs work. We hear window washer all the time as the example given in rope technician, and that's one kind of small example of all the different types of pickoffs we might be required to do. The disparity then, when approaching an arborist rescue or a pickoff, or somebody on a tower or any elevated structure, is that these are bottom-up rescues. So rescuers are required to ascend up, whether it's fixed vertical lines, a ladder with twin leg lanyards, to make access to the victim, to assess the victim. Most of these pickoffs are rescuer-based, though a lot of teams will set high points on an elevated structure and do a ground-based lower, with the climbing rescuer just making the attachments. In the case of ARB incidents, the patients may be pinned by very large or heavy leaders that they were working on, which is a class all by itself. The anchors we use or the redirect points that we use when doing arborist rescue usually are remote. We're setting them from the ground, so we can't easily inspect them. The ratings on a tree, a union, or a branch are kind of a mystery to us. And even to a lot of arborists, they put a lot of faith in experience rather than a field guide to tell you what something is rated for. And then like fire department kind of traditional pickoffs, you can have, supported or unsupported victims that are either hanging in a lanyard or a fall arrest system. We're going to talk about some patient considerations just to kind of get you familiar. This is not an EMS program, and we are not asking you to kind of remember all this in entirety, but there's some kind of key concepts with any technical rescue that we want you to remember. These are all patient-centric events, and we're not just removing a thing out of a tree, we are removing an injured person. So we need to consider, in broad terms, the concept of kind of the golden hour, suspension trauma, any major bleeding, and crush syndrome as the ones that are most likely to affect arborists. The concept of the golden hour was first coined by the the father, as they call him, of modern shock care, Dr. R. Adams Cowley. He had a quote that said, "There is a golden hour between life and death. If you are critically injured, you have less than 60 minutes to survive." So for anyone who's taken EMT, EMR, this concept of the golden hour was heavily taught probably 20 years ago as a finite time period. In reality, as modern trauma care has progressed, this expression has become figurative and really has been translated into the golden period, which takes into account both the nature and extent of the injuries. But the concept is still sound, and it's something we need to keep in the back of our mind when responding to any technical rescue incident. Again, all technical rescue incidents are patient-centric events, and we need to keep that at the forefront of our mind when working at these events. When looking at that golden hour and the studies they were citing, 50% of trauma deaths occur within minutes of injury. And this is specifically speaking about trauma deaths. So these are catastrophic injuries to the brainstem, the aorta, the heart, and the spinal cord. So out of all trauma deaths, 50% occur within minutes due to kind of these kind of catastrophic things happening. So just as an example, if we look at this picture here on the screen, the victim is kind of half pinned, but if you can imagine, he was under that large leader, and we had brain matter coming out. Patient was completely crushed. We have to immediately stop, do a really good kind of big picture view of what we're looking at. This is a very, very high hazard scene for us. We are typically not trained or qualified to do kind of heavy rigging in a tree. While there are a lot of correlations between kind of USAR type work and this, if this patient is obviously deceased with a major catastrophic injury, we really need to start thinking about rescue versus recovery and getting additional resources to help us remove the body. So in the duration of that hour is when another 30% of trauma deaths occur. These are the victims that have made it to the hospital but have still severe complicating injuries. Typically, once they make it past an hour, their chances improve a little bit. And in the days and weeks that go by, the rate of death tremendously goes down. But generally speaking, when they look at studies of trauma deaths, 80% of trauma deaths are occurring in the first hour after injury, which is really where the golden hour concept came from. So if you keep that in mind when approaching any technical rescue incident, we really need to focus on treating major life threats, removing the victim from the circumstance they're in, and providing rapid transport to a definitive trauma care center. Right out of the PHTLS book, which is the Pre-Hospital Trauma Life Support book, oversimplified, the goals for pre-hospital trauma care should be accessing the patient, identifying and treating major life threats, and transporting them to the closest appropriate facility in the least amount of time. So this really requires a coordinated effort between the fire department or the tech rescue team and a local kind of paramedic level ambulance service to make this happen. One of the big things we want to talk about that's very relevant for both working arborists and rescuers is something called suspension trauma. This has several names depending on when you learned it: harness hang syndrome, harness-induced pathology, and basically it's caused by decreased cerebral perfusion leading to syncope. So decreased oxygen getting to your brain, causing you to pass out. It's always been kind of speculated that this was caused by decreased blood return from your legs, or what's called distal pooling. And there's been some studies recently that kind of looked at this in depth to provide us a lot more insight. So in 2019, a big group got together. They found 30 volunteers to assess what they called suspension syndrome. And they put all kinds of monitoring equipment on these volunteers. They wanted to measure venous pooling, so deoxygenated blood in the legs, using distal, meaning far away from the heart, SpO2 monitoring, so your pulse ox, the size of the superficial femoral vein, which is a vein that returns up from your lower extremities, by measuring what they call localized bioelectrical impedance. It's a lot of fancy words to really get in-depth monitoring of venous pooling. They also measured hemodynamic response, so for the victim overall, by looking at heart rate, blood pressure, the stroke volume of their heart, and the size of the left ventricles. What they found was pretty amazing. They noted a decreased venous return within minutes of hanging suspended without movement. And in 30% of patients, or the volunteers for this study, they found some very sudden pre-syncope symptoms in 30% of patients almost immediately. They concluded that time to pre-syncope, meaning feeling like you're going to pass out, was very unpredictable. But the biggest takeaway for us as rescuers should be that they found that all symptoms resolved and all the volunteers' vital signs returned to normal within 5 minutes of being placed in a supine position. So depending on when you learned about harnessing syndrome, there was people teaching to do the recovery position, Trendelenburg, all kinds of other things. In this study, they kind of conclusively showed that placing them flat on their back, loosening harness straps, had all symptoms related to the harness-hang syndrome resolve within 5 minutes. Now, that doesn't resolve any medical emergencies that happen concurrently, any trauma, anything like that, but just the symptoms from harness-hang syndrome. So as rescuers, we need to be very acutely aware of both the victim status and our own as rescuers. So while these are kind of broad, the signs and symptoms of pre-syncope are dizziness or lightheadedness, nausea, vomiting, blurred vision, a sudden feeling of warmth, or pallor changes. So all of a sudden, somebody who is kind of warm and pink is now very clammy, cool, and sweaty. So it requires a lot of communication as you're making access to the victim to kind of look for these signs and symptoms, be aware of them in yourself, and be aware of them in your team members. So as you're approaching an arborist that might be stuck in a tree, as far as treatment goes, there's not much we can do medically while they're still suspended because the venous pooling is still happening. But if they're conscious and we can talk to them and they're showing signs of pre-syncope, try to advise them to kind of move their legs around, flex their muscles while we're waiting for rescue. Sometimes that's possible and they can kind of be help for themselves. If they're unconscious, unfortunately, obviously they can't help with that and we need to get them down immediately. Again, this might be a compounding issue with the either medical emergency or trauma that happened. They might just have a left arm or right arm injury and they can't operate their system, but they can still move their legs around. So once we get them down, we need to get them flat and then obviously treat for trauma or the medical emergency, whatever your local protocols are. I can't overstate this part enough. For us, we need to be super aware of this and prevent this from happening to us. We need to move our legs around frequently if we're going to be hanging in a harness. Put your legs up on the tree, on a ladder, whatever the platform is you're working on, and instead of just hanging there like a rescue mannequin. The study did find that the symptoms can occur, pre-syncope symptoms can occur in as little as 13 minutes. As instructors, this is something we deal with a lot. That's Sean Emmons, one of the gentlemen who helped us develop this program. The instructors always play victim. We don't use mannequins, we use live victims. We find that becomes much more realistic training for rescuers in handling patients safely. So we are always checking in with each other, and there's been quite a few times while waiting extended periods of time for rescue in a complicated scenario where the instructors have to kind of come out of their placement, so to speak, to kind of stand up on a limb and get blood flowing again. So it's very important to be aware of for all of us as well. Some of the other big ones we're looking at are obviously major bleeding, which ultimately leads to shock. So chainsaw injuries, as you can imagine, are devastating and can cause kind of deep and severe lacerations. Oftentimes, these injuries in trees are to the left arm and left leg. A lot of arborists will kind of one-hand their top handle saw, and since right-handedness is predominant with the population, we get a lot of left arm and left leg injuries. Again, we talked about kind of big commercial outfits that do things very safely and by the book and have rescue plans. And there's a lot of fly-by-night arborists working, and the level of safety they choose to provide for themselves or their employees vary greatly. I've seen plenty of people up in trees without any PPE at all, no helmet, no safety glasses, no hearing protection, no chainsaw pants, and everything in between. So this is a huge problem. If we're in a tree with them, especially if it's going to be kind of an extended extrication, but almost always, if they have any kind of major bleeding, we really need to consider tourniquet placement in the tree or use of a hemostatic dressing to stop the major bleeding before we start messing around with evac. I would highly encourage all of you, if your team's going to participate in rescues like this, to make a little, I'd call it an IFAC, but it's not really for you, but a little mini trauma kit that can easily be worn on a harness that just has some kind of down and dirty bleeding control equipment. Tourniquets, hemostatic dressing, some gauze, some Curlex, something like that. So we can at least kind of slow or stop the bleeding once we make access, and then we can worry about evac. Once you get them down, if we still need more definitive bleeding control, and then we need to get rapid transport to the hospital. Another important one to be aware of for all technical rescue incidents is crush syndrome. We can find this in man versus machine, in trench, and certainly in arborist emergencies. So crush syndrome is a medical condition characterized by significant systemic symptoms resulting from toxins released by crushed muscle tissue. Crush injuries are common in severe trauma and include direct soft tissue destruction, bony injury, and limb ischemia. Basically what's happening is when the extremity is crushed for a prolonged period of time, it prevents blood return to the heart. As muscle tissue starts to die, toxins are released in the blood system, different types of electrolytes that can be fatal. And once the limb is released, all of that stuff can get back into central circulation. We can have kidney failure down the road or cardiac arrest. So depending on the degree and the extent of the compression, the size of the muscle compartment, and the amount of toxin release, this can happen very, very quickly in as little as 60 minutes. So there are significant ALS guidelines for crush syndrome, but as rescuers, we kind of need to be mindful of that. And if we have an extended extrication with a crush injury in a tree, we need to communicate with ALS resources on scene if there's anything else that might need to be done in the tree before we do final victim removal. So the rate of non-fatal injury in tree workers is about 239 on average per 10,000 workers, which is 168% higher than the all-industry average of 89. This is a very hazardous job, as you might imagine, and the rates of injuries are oftentimes underreported by the fly-by-night organizations that might not call 911, which then results in an OSHA visit and other local authorities. So most of the studies indicate that these numbers might be lower than that are reported. The most common type of non-fatal injury is contact with objects and equipment, is how it's classified by the Bureau of Labor and Statistics, which is almost half of injuries, which includes struck against object or equipment at 6%, struck by falling object at 14%, and then all other contact is 29%. The second leading cause of non-fatal injuries is falls at 33%, which is pretty standard in most industrial incidents. On the fatality side, this is one of the falls, or one of the fatal four, as OSHA calls them all the time. The fatal injury rates are pretty significant as well. Tree workers have had one of the highest fatal injury rates of any occupation since 2006. The average rate of fatality is 110 per 100,000 workers, which is 30 times higher than the all-worker rate of 3.4. And from 2006 to 2015, approximately 66 workers died every year. 65% of fatal injuries are from being struck by a falling object, and 74% of those were struck by, obviously, trees or logs coming down. So when we talk about sizing up trees, I want you to think about this just like sizing up a house. If you show up to a structure fire or sizing up any other technical rescue incident, there's kind of certain benchmarks that we should look for, certain things that we should kind of start taking mental note of. And this size up is very similar to how arborists might size up a tree as they're approaching it to do work. The first thing we want to look for is signs of dead, damaged, or dying trees. We're going to look for cracks or brittle bark, deep splits in the bark that extend into the tree, internal or external cavities, We have deciduous trees, so trees that lose their leaves, exhibiting a lack of healthy leaves in spring, summer, when they should have leaves. Coniferous trees or cone-bearing trees that start showing red, brown, or yellow needles, or an abundance of deadwood in a tree, can all be kind of signs of dead or dying trees. These trees might also be host to fungus, which is a good indicator of decay. If we see a lot of mushrooms around the tree or the base of the tree, or a lot of pests, you see big holes in a tree like that, those are all signs that there might be some issues to the tree we need to be aware of. We're also going to look for root damage, thinning foliage. Some of this stuff is more applicable to arborists that have a relationship with somebody, but poor yearly growth, yellow undersized leaves or dead branches, if there's odd growth patterns, development of a sudden lean, or the cadmium layer, which is kind of the outside layer of the tree, is dry and brown, and it should be kind of normally green and healthy. So some of these are more arborist specific, and without more training, this might not be familiar to us, but just some stuff to be aware of. We're going to talk about the site hazards at arborist work sites, and this is stuff that they're up against, but it's also stuff that we should kind of be aware of when we show up. So we have a lot of heavy equipment, right? We have chippers, saws, we have the spider lifts like you see in this picture right here. Sometimes you have excavators, skid steers. There's all kinds of things going on. Then you have all kind of the tree hazards, right? So you have hangers or widowmakers, so big limbs that are stuck up high in a tree, either from partial work being done that caused the injury and us responding, or stuff that was there during a storm, and maybe that's why the arborists are there. Partially fallen trees, and then we kind of have the atmospheric hazards, right? So loud running equipment that makes communication difficult, and electrical hazards. So wood chippers and ropes do not mix. You will find on any good arborist worksite very clear and consistent communication between the climber and the team working on the ground. Depending on the climbing system in place, you can end up having the tail of the climber's rope on the ground, which is also attached to the climber and then up to their anchor. And if the grounds team isn't paying attention and that rope gets wrapped around some of the brush getting fed into a chipper, it can kind of violently and catastrophically rip a climber out of a tree. So obviously that was a simulation set up at a safety day. The slow pull at the beginning was kind of the feed wheels pulling the rope and the limb into the chipper itself. Once that rope hits the chipper drums, it gets sucked in very, very quickly. So if you can imagine that tail end of the climber's rope getting sucked in while they're 30, 40, 80 feet up in a tree, and the damage that could cause the climber if that happens. Again, we talked about a lot of the heavy equipment, but there's a lot of heavy equipment at these work sites. Stuff can tip over, stuff can be dropped, so there's a lot of falling hazards that the arborists have to contend with. If any of this equipment's still being used, if you show up, obviously you should find the site supervisor, have them shut everything down. I would imagine that most work sites would shut down if there was an injury, but weird stuff happens. Couple quick examples of hangers. The one on the left is actually leaning on a power line. But as you approach these, always really look up. From far away, get a good size up of the work site, try to see what's going on. You don't want to be standing under one of these things and not realize it. Electrocution is another big one. Arborists need to be certified to work near electrical lines, so not all arborists can. That said, a lot of them that should be aren't and are still working near electrical service, homeowners on ladders, and it does not take much to kind of make an ill-placed cut and have a leader or something drop on either service the house or kind of a high voltage line. But there's a lot of electrocutions every year. So now we're going to go over common equipment used to climb and move around in trees. Some of it might seem familiar, some of it might be completely foreign. So we're going to try to give you a good introduction in advance of in-person practical training, just so you're a little more familiar. So the first thing we're going to talk about is saddles, as what arborists call them, or a harness. So most climbers are using a Class 2 seat harness, though some put suspenders on, or an actual upper for their harness that might convert into a Class 3. Modern climbing saddles look very, very similar to rescue harnesses and have some similar features. These can be heavily user modified to make kind of personal choices on setups. And the biggest takeaway to remember is that there's no standard color coding for life support rated connections. Some brands do have color coding for life support connections, but there is no industry standard. So instead of having a ventral D-ring like a fire department Class 2 harness they have a rope bridge, they call it, and that serves as their primary tie-in point. So it goes from left to right, and this is where the climber is going to tie in. It allows them to kind of rotate left to right instead of being stuck on one ventral attachment D-ring. Fire departments can use this bridge for pickoffs if needed. It's just very, very important since it is rope to inspect it for damage and integrity before we commit anything to it. Like a lot of rescue harnesses, these also have side work positioning attachment points. So the lateral attachment points can either be cloth, aluminum, or steel. There are very similar, if you look in this picture just behind that, there's tool loops that are very close to the lateral work positioning attachment points. So before you attach to any of these, please make sure that you're actually attaching to a ring rated for life support and not an accessory loop. These are to be used in tandem only for work positioning, and typically we wouldn't want to do a pickoff from here. It'd be very uncomfortable. However, if the rope bridge was completely damaged and we didn't have another choice, you could, but they have to be used in tandem. A lot of saddles also have rings on the top of the leg loops where the bridge terminates. These also can be used for pickoff. A lot of arborists will use these for work positioning as well. Again, these are used in conjunction. We could make a bridge if the primary bridge was damaged with a short sewn loop webbing or bound or sewn loop prusik and 2 carabiners if we needed to create a secondary bridge for pickoffs. Here's an example of a modification. This harness has had a second bridge added with a swivel on it. It's a personal preference. Again, as you approach, just get a good look at what the climber is wearing to inspect it for any damage. Much like our harnesses, there's a lot of accessory and tool loops on the back. None of these are rated for life support, typically. There's a haul loop at kind of the small of the back on harnesses, which a lot of arborists will use to terminate a lanyard with kind of a tearaway attachment, but this is not rated for life support. This harness has color-coded attachment points for life support. So this harness has a ring built onto the bridge, which is the primary tie-in, and you'll see the lateral work positioning attachments and the work positioning attachments on the leg loops are all green. This is this product only and not standard in the industry. If we look at the back of this harness, they've made these 2 accessory loops red because they're not rated for life support, as well as that haul ring on the back. But again, there is no standard in the industry. As a default, our personal preference would never be to assume just because something's green on the back of a harness that it's rated for life support. Use the lateral attachment points to the bridge or create a false bridge with the 2 other connection points on the leg loops. Here's an example, same brand. They have created a life support rated attachment on the haul loop and colored it green. You can see those accessory loops are red on the right. I wouldn't make any assumptions when attaching to the back of a harness. Try to go to the front. So some old school saddles, cheaper. They probably still make these, but much more cheap. Much less expensive than some of the pictures we just shown you. So you have 2 steel connections here as a primary tie-in point. You still have lateral work positioning attachment points and some haul loops on this. This one has a kind of floating D-ring on a bridge as their primary tie-in point, and then some accessory connections as well as lateral work positioning. So climbing systems and devices. Most climbers learn or required to learn by their employer on a hitch-based system. Until they're proficient with that, they're not allowed to move on to mechanical systems. It is the cheapest to do hitch-based, requires the least amount of equipment, and provides you with a lot of opportunity for self-rescue if you're trained appropriately in it. But there are mechanical systems. There's a lot of them. Just like in the fire service, there's 19 different flavors and colors and options. But the goal of all of these climbing devices and systems is to allow them to ascend, descend, and kind of move around the tree freely and work. So the first one we're going to look at is like I said, probably the most common climbing hitch used. It's a Blake's hitch. This allows movement up and down. It will lock unless tended, much like a prusik, and they are relatively easy to unlock under load, and you'd operate the same as a prusik, just with some downward pressure on the top. The VT hitch is probably the second most common climbing hitch used in conjunction with some other equipment. This allows movement freely up and down. It locks unless tended. It's relatively easy to unlock under load, and these hitch setups are found both on single rope and moving rope systems, which we will talk about a little bit later. There are also work positioning lanyards that use VT hitches, so you might find them on lateral attachments on a lanyard, and they operate more or less the same as a prusik. So this is an example of a single rope system with a VT hitch and a rope wrench. This is a very common system used in the ARB industry for single rope technique. In SRT climbing, the user is ascending and descending on one fixed vertical line. That line is terminated either the canopy of a tree or terminated back down on the ground, and they're moving up and down that fixed vertical line. The red device above the VT hitch is called a rope wrench, and that adds extra friction. I've read that it takes almost 50% of the user's weight, so it's split between the friction hitch and that rope wrench. If you find these in your emergencies when you're responding, and the victim is still hanging in this, we never, ever, ever want to touch the rope wrench. If you start messing with that, you can unexpectedly drop the victim. So we're only going to manipulate the very top of the VT hitch by applying downward pressure. Again, we're going to go over this heavily in in-person training, but that's what it looks like. The pulley down at the bottom is called a hitch climber pulley, and the arborist would attach to their bridge with that blue carabiner at the bottom. This is another example of a VT hitch on a moving rope system. So the side of the system that the VT hitch is on is where your braking happens. The rope goes up either around a union, a branch, in the crotch of a tree, or through a kind of low friction device, a pulley, comes back down to the climber and terminates on the system. So both of these ropes are moving with the climber as they go up and down. This hitch does not require a rope wrench because the user's weight is being split between both sides of the system. There's lots of other names for the system, dual rope system, DDRT. We're just going to broadly call it a moving rope system. And this is, again, something we're going to see a lot in hands-on training. So there's lots of commercial devices that have been manufactured over the years that basically act as a friction hitch. They all have the same function. Some of them look very, very different. This one is the Petzl Zigzag. It allows upward movement without tending. To come down, you have to tend the top. Most of these can be used in both single rope and moving rope systems. Another example of a mechanical prusik device that acts as a hitch. This is the Rope Runner Pro. Function, again, is the same. It allows upward movement without tending, locks when you sit into it, and must be tended for descent. Some of the other things used by arborists to climb are knee and foot ascenders. They have a toothed cam in there, and these are basically mini chest ascenders, if anyone's ever used one of those. Just varying sizes. Usually these are used for rope walking. So it'll be a SRT system with a foot and knee ascender, and you're kind of getting much faster climbing when you use these. The function of these is all more or less the same. You have to kind of unweight it first to swing the cam down and out of the way. So as you're approaching arborists stuck in trees, start asking questions about, hey, do you have a knee ascender on? Do you have a foot ascender on? If they're unconscious, check. If you start lowering or picking somebody off and they have one of these on and you don't realize it, you can end up in kind of a very difficult situation where you might have to kind of haul or climb back up with them to unweight this to get their foot or their leg out. Some other things that you'll probably see are spikes or spurs or climbers, depending on who you talk to. These are used in conjunction with a lanyard or flip line to ascend a tree. These are pretty much only used in removals because spiking a tree with these can cause a lot of damage to the tree. Typically when climbers are going up, they are kind of cutting off limbs on their way up, and when they get to where they're going to work, they're going to attach another rope system, either SRT or moving rope, in addition to having a lanyard and their spikes. So if you look close, it's very difficult to see. That's Sean again. He's got his green lanyard on, which is kind of lower on the trunk, and then above him, above that, you can see kind of a blue rope, which is his rope system. So once they start coming back down, they should have 2 points of attachment. That is kind of standard whenever they're cutting or working. They always want to have 2 tie-in points. The rope they use, the diameter varies greatly across manufacturers. They have both metric and standard sizes. They usually are off from kind of traditional fire department rope rescue rope. So they have 12.5 millimeter, 11.7, 11.5, 12.7. So while it might be seem easier to kind of just tie into whatever they're using into one of our devices, there's no guarantee they'll fit or work safely. So certainly we can fit, a undersized rope into a 12 millimeter device, and certainly we can probably smash a slightly oversized rope into an 11 mil device or a half-inch device. Best case scenario, the rope is bigger than intended for our device, and we have a ton of extra friction. Worst case scenario, though, we're putting an 11.5 mil rope into a 12 mil or 12.5 mil clutch, and we have way less friction than we anticipate. So just kind of keep that in mind. Certainly emergencies do happen, and we have to make kind of calculated decisions with a kind of risk-benefit analysis. But as a default, I would use your own ropes in your own devices. Lanyards and flip lines, again, Baskin-Robbins, 31 flavors. There are all kinds of different lanyards, a lot of hitch-based lanyards that offer multiple adjustment points with pulleys, VT hitches, mechanical devices. They have all different types of connectors, double and triple action, regular carabiners, snap hooks. They have wire core, nylon, Technora. It's really a full gamut of stuff. Again, just being able to identify if their lanyard is on or not and how to disconnect it when it's time is the most important part. So access equipment. Access equipment is very important for arborists, obviously, to get into a tree to do their work, but is also very important for us because we might need to employ a lot of the same techniques they use to access them when a ladder isn't available. So from left to right, we have a big slingshot called the Big Shot. We have a throw ball, which comes in all different sizes and weights, and then a cube, which stores our throw line. So these kind of basic components make up our system to make access. And the throw line is a very, very thin, light, low friction, smaller than paracord line that you want to think about as like messenger line when we're creating high lines. So we can manually throw these throw balls that are attached to the messenger line, or we can launch them with a Big Shot, depending on how high it is, and then use that to pull up our systems. Cannot recommend enough to get a Big Shot. Throwing a throw ball takes a ton of practice to get it accurate in a timely fashion. The slingshot, with a little bit of practice, makes getting especially high targets much easier.
Hey, what's up, Climber Nation? Patrick here. So I have been meaning to do a series on throw line for a really long time. You know, it occurred to me a while ago that there are like so many situations, both in climbing and rigging, that are just made infinitely easier when you have the ability to set a line in a tree using throw line. You know what I mean? Now I know that there are all kinds of mechanical things that you can use, like the big shot, and there's air powered throwers and like potato gun shooter things. There's all kinds of stuff like that, and those are awesome. The gadgets are amazing. But for me, you know, it's very, very important in my mind that you're able, at the end of the day, that you can set a line with throw line without using a fancy gadget. It's very important, to me anyway, that you can throw it a line by hand. So I just wanted to look, I wanted to start with the basic technique of throwing a throw ball by hand. So there are two main techniques, and then there's other techniques as well. But I'm going to start with the first two basic techniques. The first one is what I call like the two-handed granny style throw, right? So you're doing a pendulum like this between your legs. And this is the way that I originally learned how to throw ball, so this is the way that I still do it. I prefer it this way. I love that it's in the center of my body, so I can like square myself up to my target, and I don't know, I have better results with that. So so for the two-handed granny style throw, what you do is you take a bite of the line and you put it through the ring like this, and you pull it through. So now on the one side I have a bite, and then on the other side I'm holding just the line itself. So that's the setup. And then for me, I like to have like as long of a pendulum as possible, and I'm just swinging it back and forth in a way that keeps the slack out of it, right? So it's not just swinging it back and forth. Like there's a technique to it, right? So you got to practice that there's no slack at any point in that pendulum. Okay, so that's the two-handed granny style throw, as I call it. The other main really popular technique is the one-handed throw. And tons of people prefer the one-handed throw. So it looks like this. So it's the exact same pendulum motion. The difference here is it's off to the side. It's not in the center of your body. But like I say, like tons of people prefer this. So there's different ways of that people do this. A lot of people will tie like a slip knot in the rope, in the line, and then they'll have something that they can grip. It gives you something to grip onto. A lot of people will just, instead of that, they'll just pinch it, you know, with their fingers like this. Some people will like weave it through their fingers or something. Like there's lots of different techniques. There's tons of different ways of doing it. But you know, the basic concept is pendulum, and then you know, you launch it, right? And then those are the two main techniques, and then there's others. There's like some people, I've seen people do like this, like they'll go like this, right, and then they'll launch it like that. If it's a lower shot, sometimes you'll just like chuck it up there like a grenade or something. So those are the basic concepts of the technique, and I have some on film here that we can take a look at. Some of these are me and some of these are James. But I just want you got to wrap your head around like the pendulum motion. And then in terms of like getting better with throw line, in my mind, it comes down to three things. It would be consistency and practice, obviously, and visualization. So those three things are where I would start if I was trying to learn and trying to get better at throw line. So in terms of consistency, the number one thing for me is experiment with different size throw balls and find the weight that you prefer to throw and just stick with that, okay? So be consistent with the weight that you're throwing. I've always thrown a 10. I'm way better with a 10 for whatever reason. Tons of people throw 12, 14, 16. You can throw, there's lots of different options. There's even an 8 ounce. So there's a whole range of weights, and they will affect the way that you throw. So in terms of consistency, find the one that you prefer and just stick with it, right? Um, and then the other thing I would say in terms of consistency is that technique, right? Experiment with different techniques. Try the two-handed granny throw. Try the one-handed throw. And once you'll probably get a feel for like which one feels more natural, which one seems easier to do for you, right? So just find the one that you like and then just stick with it. That would be my advice for someone just starting. Now, I know I've talked to a lot of people who are like, well, in some situations I'll do two-handed, other situations I'll do one-handed, and that's amazing. But for a beginner, in my mind, I wouldn't recommend for a beginner to do it that way. I would recommend just stick with one technique and be consistent. Okay, so.
The Big Shot makes quick work of getting a working line into position and helps you get onto the job at hand. This really simple, oversized slingshot uses commercial-grade fiberglass extension poles to maximize launching distance.
So before we move on, I can't emphasize enough the importance of practicing with a throw line. They're relatively cheap. We sell them. You can buy them on Cheryl Tree Stuff. You can buy them anywhere online. Buy quite a few for your department or for your team. This is something you can practice out behind your station. This is something you can practice on at home. And being able to accurately place a throw ball quickly and efficiently to get that high point, to either make access or set a change of direction, is what's going to make or break your incident if you can't reach with a ladder. We will spend as much time as possible during the hands-on portion, giving you opportunity to practice with throw balls. But this is something that is a learned skill that you need a muscle memory to develop consistency with. I cannot overstate that enough. Please practice. So once you get your high point, or rather once you get your throw ball and your messenger line through the union or the crotch, the branch that you're aiming for, both for us and for arborists, there's kind of two broad types of tie-ins that we're going to talk about. This is not all encompassing of every variation that arborists might use, but from an awareness and identification standpoint, in broad categories, there's kind of two types that I want to talk about. So the first one is a basal tie. So basically a rope gets pulled up with your messenger line through a crotch or a union, back down to the base of the tree, and typically is terminated around the base of the tree. This is used for SRT climbing. So you have an anchor side that's tied around the base of the tree, and then you have a climbing side, which the arborist will climb up to the redirect point. The other option, again, generally is a canopy tie. Goes up around a limb or through a union. Sometimes it's terminated there. Sometimes it continues back down, and you have a moving rope system. But if it terminates there, it would be an SRT system, and that leaves both the climbing side and the retrieval side of the rope down on the ground. So I'll show you some pictures of both and some options for us. But those are the two basic types. So in a basal tie or a basal anchor system, the throw line, as we discussed, is sent up and over a union, pulled back down. So what we're looking at here with those two arrows is the anchor side of the basal tie. So a very common method is using a running bowline, which is kind of the lower arrow. So that redirects the rope back up to the union. And good arborists, I would say, put a butterfly or some other kind of midline knot a little bit above that point of the running bowline as a break-in point for their coworkers or us to be able to lower them off from the ground if needed. Typically, out of efficiency, the arborists are climbing out of the bag side of the rope. What I mean is they pull the terminal end out, send the terminal end up and over, and then tie their anchor with the terminal end. So they're not paying out all of their rope to get started. From a rescuer standpoint, I would typically suggest climbing the terminal side of the rope. And when we if we're building basal anchors, putting some kind of descent control device at the base of the tree. So if something happens to us, we already have a descent control device in, and we're climbing the terminal side of the rope, which leaves the rest of the bag there, so we can lower somebody off, which is something we'll go over on practical day. But this is a very common setup. If you look to the right, there's a green basal tie that was done differently. Without zooming in, looks like it's probably a figure 8 with a carabiner, and it's the rope is redirected through the carabiner. Lots of variations on this. The idea with the running bowline or the carabiner or a ring is that once you weight it, it cinches down around the tree and prevents it from walking up. So if we want to break in as first responders into a basal tie, the most important thing is not to cut anything. The idea, I believe, when this was first designed, putting that butterfly above the running bowline, was that you could clip into the butterfly to capture their system, cut the rope in between. But there's actually been arborists who have had ground falls as a result of someone cutting it without building a system first. So as first responders, keep knives and anything sharp away from rope. We are very, very smart, qualified people who can design a system to haul and untie something rather than cutting it if we need to. So first and foremost, don't cut anything. If we want to lower somebody off that's got a basal tie like this, they can't be in a lanyard. If the climber is conscious and injured, we may be able to have them remove their own lanyard and then we can lower them off. If they're unconscious or unable to remove their lanyard, we will still have to access the victim to remove their lanyard before we can lower them, but we may be able to lower them from the base. So what we're going to do in these situations is we're going to create our own anchor at the base. So the rescuer who's kneeling down is creating an anchor for our stuff. We can either attach a descent control device, a ID, a rig, a clutch, a maestro, right to that point. Or we can do a change of direction at the base and do a remote anchor someplace else with our descent control device. If we're going to do a remote anchor, we have to use a change of direction at the base of the tree. If we don't, once we kind of untie that, that rope is going to go, it's going to equalize basically. So you're going to have a big kind of, you're going to have a plumb line, if you will, between your base remote anchor up to the change of direction of the tree. I know that's kind of hard to visualize, and we can show you in person, but we want to keep a change of direction at the base of the tree to keep their climbing system in line with the tree, so the climber doesn't have an unexpected drop, basically. So this team elected for a change of direction at the base. So you can see that the Rock Exotica swivel pulley there is the change of direction. The green line is the fire department's system tied into the butterfly, which is the orange line up there at the top, the climber system. They are untying or have untied the basal anchor that was a running bowline. If there's no midline knot there like a butterfly, we can use a rope grab of some kind. The only thing you have to be careful of, both with a butterfly or some kind of mechanical rope grab, is you might get to the union with that device or the knot before the rescuer or the arborist gets to the ground, depending on how much stretch you have in the rope. So you really do need a spotter to watch where that butterfly is, or the commercial rope grab device, because if that gets up and over the union, it could jam or tend it, and we don't want that. And then we can lower them off if they're not tied in with a lanyard. So here's kind of the end game of all this. Different rescue, but same concept. So this team elected to do a descent control device right at the base. So if we start from the bottom of this picture, you have that kind of, you have two different yellow lines. One's got a red prusik on it as a cinch. They put a clutch right at the base of the tree. They tied in to the butterfly that was in that orange line, which is the climber's line. So they've untied it now, and he's just holding a little back pressure on it. Good work practice, not necessary, but that's the untied anchor of the climbers. And up top, you have a very happy climber being lowered to the ground from the base without any rescuers having to go in the tree. Again, this is an option. It's not always going to be an option, so you really need to be able to size up the incident and understand what you're looking at, but we may be able to lower a climber off on their own system without us ever having to go up in a tree. Another type of tie-in, a canopy tie, sometimes called a cinch tie, very, very simply, we're going to throw our messenger line up with a throw ball, bring our rope up and back down, and then either using a commercial device or a knot like a butterfly, we feed the rope back through itself, and one side becomes a retrieval side and one side becomes a climbing side. So if we pull the climbing side until the knot or the device gets to the union or the branch, we have a single rope that we can climb up. And when we're done, we pull on the other side, which is the knot side in this picture, and we'll retrieve the whole system. So this is really good down and dirty for quick access to get up in a tree. So kind of zoomed out, this rescuer's climbing on an ID, so probably climbing on rad. You can get almost all the way up to your tie-in point, and then if you need to go higher, you can throw a lanyard on, and you can use a throw ball and kind of set a higher anchor if you need to. If your organization wants 2 ropes in place, you can set a backup line once you get to another limb. The only downside to this, well, there's a couple downsides, but one of the big downsides to this is if this rescuer has some kind of emergency themselves, they're really on their own to lower themselves back out of a tree. With kind of a cinch tie like this up in a canopy, we have no real ability to rescue them from the ground. Pulling on the retrieval side will just suck them farther up towards that redirect. Some other kind of canopy ties, and I kind of use that term loosely, are either what's called a false crotch or a friction saver. These either can be set from the ground, or climbers might use SRT to get up to their tie-in point and set something once they're up there. Most often, if not always, these are used for moving rope systems, basically because they don't want the rope kind of constantly running over the bark of the tree, which can severely damage the tree. It also decreases friction, and this ultimately is safer for climbers than a basal tie. One of the more common, or I should say common, arborist accidents that you have to think about is, so when you're using a basal tie, if we go back a couple pictures, that arborist system, right, if this is the termination side that rescuer in red is holding on to, the climber is on the opposite side of the tree and doesn't really have good eyes on that rope. So if they're taking limbs with either a pruning saw or a chainsaw while they're working, it's very, very easy to hitch your own anchor strand that goes down the back side of the tree with a saw of some kind. And if you're not wearing a lanyard, that's a quick ride to the bottom. So a lot of climbers are not fans of basal ties once they start doing work, because their anchor is kind of easily exposed to the saws they're working with, and kind of stuff on the ground. So what a lot of climbers will do is use SRT with a basal tie to get up to the tree, and they'll set what's called a false crotch or a friction saver, and then convert to a moving rope system, so they don't have that anchor strand down on the base. Lots of different variations of this. There's commercial devices. The first picture, the yellow thing, is a petal eject. The other one is a big ring, small ring friction saver. And then the last one actually is just a hauled up block or a change of direction pulley, which is another option. This is something that we're going to talk more about on Practical Day. That farthest picture on the right is a way to kind of set an elevated high point and haul up a rescuer from the ground rather than somebody climbing. So all different variations. The end goal, all of them, is the same. It's to reduce friction for the climber in a moving rope system and to help protect the tree. Many of these can be set from the ground without ever having to set foot in a tree, which is kind of a little bit of magic and wizardry when you see it. Some have to be set in the tree, but almost all of them can be retrieved from the ground once the climber comes back down to the ground. So we're going to watch a video that kind of gives different overviews of single rope systems, single rope technique systems, moving rope systems, and a couple of the hitch-based systems. So we can kind of get a better understanding and visualization of all the different equipment we've talked about, putting it all together to kind of get a better understanding of what the climbers are doing, getting up in the tree, and how they're moving around.
Type of climbing and the impact that the system has had on it. So First thing here is we have our DRT or DDRT or MRS. That's double rope technique or doubled rope or moving rope system. So there's a lot of acronyms. Kale can pop those up on the screen everywhere and show you. But essentially this is one piece of rope and it's doubled over an anchor point up in the tree. I've load tested it, checked it out, and everything seems to be okay. So the most basic type of climbing that I will teach to people is going to be the Blake Sitch. So you can tie in with a variety of different types of anchor knots. You could use a figure 8 here or even a bowline and use the tail, but in this instance, I'm just going to use 2 half hitches. I've demonstrated this very basic technique before, and I feel pretty comfortable with it. So I'll set this distance here, an appropriate amount. Usually I check that by about how far I can reach out. And then we will tie our Blake Sitch here. And then we'll make sure that we can tie our safety knot in the end here. Expertly spaced, of course. And this is a Blake Sitch. So there's videos on how to tie this knot. If we don't have a video on this, I'll definitely make one, but you can check that out. Here you can see the Blake Sitch is able to support me, so it serves that stop function, and I'm able to go up, and then also come down. So we've got the 3 basics of climbing, right? Up, stop, down, and you can see that with the right amount of effort and some spinning, I'm able to go up pretty, I don't know if easy is the right word, but effectively, and I'm able to get up the rope. So that's the basics of ascending with a Blake Sitch. There are other ways. See here, I'm able to take a foot lock and stand up, but I still need, sorry about the spinning here, I still need to be able to advance my hitch. It's certainly not easy, right? So if I added a foot ascender to this technique, you can see that I'm able to stand, but if I let my foot go back, if I let my foot go back up, I haven't gained anything. So I need to stand and then adjust. Feed the ascender, stand, and then adjust or advance that hitch. This works, and it's an invaluable technique that I think every climber should know. You may find yourself in a situation where you need to use the end of your climbing line or as an additional positioning aid, or you might find yourself in a situation where you need to do a self-rescue. And knowing these techniques, not needing a bunch of flashy hardware, I think is really important. So here, by using a basic prusik, you can attach this cord to your main line that's not moving, and then being careful not to put the pulley on the bridge, which is what this is called, not to be confused with your rope bridge. You can clip the pulley underneath your Blake Sitch and attach it to this prusik, which then creates an adjustable tending point. So now I'm able to sit underneath, and as I'm pulling, you can watch this pulley is going to pull this up. And I can size this appropriately and fine-tune it until it works really well. Maybe I needed an extra couple wraps here because you see this prusik isn't holding super duper well, but that's a quick way to take this setup here to the next level. When you decide that you're ready for the next set of DRT systems, I definitely recommend getting a rope with an I-splice on it. And the reason, I'll show you right now. So same rope, but now we're using the end with an I-splice. And we're gonna bring in a 3-hold pulley and another closed prusik cord. So I'm going to choose a knot here. We have a whole video on knots if you want to look at the different types of prusiks that you can tie, but I'm just going to pick a good trusty knot that I hope will work on the first attempt here. We'll add our pulley. And our carabiner. We'll bring a second carabiner in here and go through the eye splice. Make sure that we're not all fouled up here. We'll clip in here. So this is one of the more well-known climbing systems, is your hitch climber system. This can be done with a variety of different pulleys, hitch cords with and without a prusik. And now, let's put it this way so it's a little easier to see. You see that what we have here is that by pulling up on the bottom, I'm able to tend that slack. I can still hip thrust, but I still need to stop and pull the slack out beneath me. The big difference here is that when you're in the canopy or you're limb walking, you're able to handle the slack really efficiently, and it doesn't require a two-handed motion to advance that knot like you saw with the Blake's hitch. Even with just one hand, I can go like this. But as I walk away from my anchor point and I'm coming back in, you see I can really easily tend that slack. There's very little sit back, and this system is really tunable. It works really well. So that covers the basic advanced DRT system using a hitch. But there's also a ton of really great mechanical devices out there. The #1 mechanical DRT device is going to be the Petzl Zigzag. So here we have the newest Petzl Zigzag. This is a really great device, and this uses a chain system to simulate and replicate what the prusik does. So you'll see I have to feed the rope through here. This is not midline attachable. Most climbers, I say, would keep their zigzag on the rope. This process can be, depending on how old your rope is or how you have the end finished, can be a little bit of a bear, but once it's on, it's just gonna fly through. And once it's set up, it has all of the benefits of a hitch, every one of them. But it also does certain things that the hitch doesn't do well. It doesn't require any customization or configuration. It's just gonna work for every climber right out of the box. Unlike some other mechanicals on the market, this one is really good because it's super intuitive. There aren't brake blocks or weird levers that you have to pull. It uses the same motion that you use with the hitch climber pulley. And you can see that I'm already showing you that same action, right? Instead of pulling down on the hitch, you pull down on this chain, and it is really, really smooth. I gotta say, there's not a mechanical on the market, SRS, DRS, or anything, that is as smooth as the Zigzag. It's just a great all-around system. As we move away from the Zigzag and away from DRT or MRS, we start to add in an extra point of friction if we want to climb SRT or SRS. I'm gonna get these acronyms confused, I'm sure of it, before the end of this. So when you are moving from a hitch-based system, so you have your hitch climber pulley and your hitch, you can add in extra friction above that using a rope wrench. And after I'm done demonstrating what the Zigzag has done, I'll show a rope wrench system with the fusion tether. This rope wrench is on a Rope Logic fixed tether, which is very similar. And it works with, say, the hitch climber pulley and a prusik, but we'll show a rope wrench system here in just a second. Petzl, with the chicane, it really did a great job. It's got a 2-button open here, and you see inside, much like a rope wrench, it's gonna apply a bend in the rope when you pull down on it, and that's gonna give the climbing system beneath it, in this case, a Zigzag, the extra friction that it requires to work. Now, the Zigzag is only configurable with this one specific carabiner, so you do have to make sure you have the right Petzl H-frame. But once you have this set up, it's gonna work like the friction hitch and rope wrench that we're gonna demonstrate here shortly, but it has that smoothness that you would associate with a Zigzag, and it has that intuitive use that you don't really need to teach anyone how to do anything different. A Rope Runner Pro, for example, or an akimbo, which we'll show here in a second, it's a different motion. It's not like just using a hitch, so it's definitely a little different. This is a really nice setup. If I had to say that there's a downside to the Zigzag chicane, it's that it's not midline attachable, and it doesn't go to zero the same way. With a rope runner, taking a big swing or something like that, you can disengage it pretty much to zero and then feather it back on. If you're doing a limb walk and you're running back out, it can be really difficult to break both of these and to get it where there's no friction. And sometimes that little bit of friction as you're trying to fight can be, I think, problematic. Overall, I think the Zigzag chicane is a really premium SRS system, despite some downsides. But I think it's a great example of how you can transition from DRT to SRT, or MRS to SRS, with an extension of the same hardware. And we see that same thing, like I just mentioned, with the hitch climber pulley and the prusik that go on there. So let me put this rope away, and we're gonna switch over to this other fixed line now. All right, so here we have a fixed single line, and we're gonna show what a rope wrench system looks like. So we talked about how you could take your hitch climber pulley, your prusik, and your carabiners that you already had, and you could add a rope wrench to it. That works great. Tens of thousands of people are doing that. Now you're seeing these new stiff tethers come out, and they are rigid tethers, I guess you would say. And they are really, there's a reason that people like them, and I think it's because it's a really superior experience. You see, there's nothing to drop with the carabiner. We actually have a video, just a whole series of videos just on this product. I made a couple videos. The Tree Thinking team made a couple videos, so it's a really good option to have. So I'll come on here, I'll tie another nice reliable hitch, and then we'll use this to talk a little bit about some of the general benefits of SRS climbing, or SRT, and the rope wrench system, and then we'll move on to the mechanical SRS or SRT systems that are not based on like the premise of a hitch or like the Zigzag. Jeez, I'm talking too much and not looking at what I'm doing. I forgot to put the rope in there, so just to show you, everybody makes mistakes. All right, so there we go, we're all set up now. So I caught that in my little check there. Goes to show you why you should always check your gear. So here we are, we're set up, and I think you can kind of envision how there could have been that hitch climber pulley, the rope doubled over. This is very similar. You can see it stops, it goes down, and it presumably goes up.
So definitely a down and dirty kind of quick look at the kind of different options for single rope or moving rope systems. we'll spend lots of time with hands-on, both kind of practice and rescue scenarios. But that's kind of a quick look at what those systems look like. As we kind of move on, then the next kind of biggest thing is incident command, right, for ARB rescue incidents or any kind of Persian entry emergency. So we've kind of created a command checklist to kind of aid with this. This will be emailed out to all registered participants. You can keep it, you can use it for your organization, and hopefully help you kind of approach these a little more consistently. So we're going to break this down into 4 phases. This is not something we created. This is a pretty standard thing in the search and rescue community. So we have our size up phase, we have our pre-rescue phase, the rescue phase, and then finally demob or termination of the incident. Just like any other incident we respond to from the fire department perspective, we're going to have the first arriving officer is going to establish command, get a really good scene size up, and start kind of making the request for additional resources as needed. So you get on scene for an incident like this. We're going to establish command and take a really good look around. If there's any obvious hazards that we can control, hazards to us or any bystanders, right, move bystanders back, look up in the trees, find the site supervisor. Hopefully they're not the person that's injured. If there's some other company rep on scene that we can make contact with and, kind of find out, number one, what's going on, shut all the equipment down, establish a perimeter or safe zone if needed, if we have partially fallen or hangers, and then find out where the arborist is and what happened. So if they're in the tree, we're going to use the checklist below. If they're on the ground, once kind of the scene has been made safe by us, then we can kind of start patient care per local guidelines. So this whole class is kind of based on the premise that they're in the tree. So we're going to progress down to the bottom. And right away, we're going to start talking to the arborist. Climber, if you can find out their name, even better. Hey, Jim, my name's Kevin from the fire department. What's going on? Are they conscious? Can they tell you what happened? Can they assist with their own rescue, right? Did they cut their climbing line and they're hanging in a lanyard? Can you get a throw ball up to them and they can pull up a rope and get themselves down? Can they just take their lanyard off when it's time? Find out if they're pinned in the tree by something or if they're free hanging. Ask about any major injuries if there's any. And then very quickly, we need to start working on that incident action plan. So can we reach them with a ladder or bucket truck, a ground ladder perhaps? Try to figure out what kind of climbing system they have in use. Ideally, if they're conscious, they can tell you. If not, you're going to have to use the skills you learned in this class to go visualize it and identify it. Figure out if the tree was being removed, if it's a takedown or if it's just being pruned. Is it a normal, healthy tree? That kind of takes away a lot of our concerns that we might have to worry about. And take a look at the tree, again, make sure there's no obvious instability, anything we need to worry about. We're then going to determine if it's a go or a no-go, meaning we in rescue mode, it's a viable victim, there's no unsafe conditions that we can appreciate, or it's no-go, it's recovery perhaps, or there's an unsafe condition. So sometimes we have the opportunity to stop and make the scene safe for us before proceeding. Sometimes we don't have that option. And once we get there, we can kind of determine, can we handle this with the resources on scene? Do we have the equipment? Do we have the ability? Do we have the personnel? Or do we need to call for additional resources? This might be an additional arborist, a bucket truck from your local tree warden, ladder truck from a mutual aid department if you don't have a ladder truck, a tech rescue team. I will highly encourage you to kind of reach out to your leadership and try to make connections in your own jurisdiction with kind of vetted professional arborists that have aerial rescue training, and find out if they'll be willing to be kind of on an on-call sheet for you for these types of emergencies. There are plenty of municipalities that we've worked with that have started kind of developing these relationships, and it's an invaluable resource to have, where if you get dispatched to an arborist rescue, you have a phone call that you can make to somebody who will show up, is trained and credentialed to assist you. And that discussion can happen kind of internally, whether they'll be covered by your municipality for any liability, because that's an obvious concern, or if they're just there in a kind of advisory capacity. But make those connections early before you respond, because kind of cold calling businesses and trying to have those discussions when you need somebody right now is really not realistic. So part of our size up, and I touched on this briefly, but we kind of needed to consider this go, no-go decision. This is a command level decision. Certainly influence from experienced practitioners on scene, people who have taken this class can help. But we need to decide, is this rescue mode? We have a viable victim, no unsafe conditions. Do we have a viable victim and no unsafe conditions, but we need additional resources before we can start rescue? Right, this might change after we develop an incident action plan, or is this a no-go right now, either because it's a recovery, an unsafe condition, can we stop and attempt to make safe before proceeding? It's going to be one of those kind of three things. Yes, we can do this. No, we can't. Or maybe if we get more help here. And the earlier you figure this out, kind of the better off you'll be. So once we get into pre-rescue now, we need to kind of establish some type of incident command structure, which is similar to all the other incidents we respond to. So we need a safety officer. I would consider an operations officer if you don't have an incident commander with any experience in this type of rescue. You need to develop an incident action plan. Doesn't necessarily need to be written down. It can be verbalized. Most incident commanders, if they have an aide, will probably write it down right then anyway. The incident commander will have to document it later down the road, but it doesn't have to be on paper right before you start rescue. You should definitely have some kind of planning going on with a couple experienced techs, having a plan B, a plan C, a plan D of what your options are if you start running into hiccups. You need to have both, an assigned primary rescue team and a backup rescue team ready. These are very, very labor-intensive operations, and I would kind of think about these kind of like confined space where you might need to kind of send additional resources up into the tree for either more equipment or to assist as they kind of figure out what's going on. And then have a kind of a quick down and dirty rescue briefing, assigning all these roles, kind of duties, responsibilities, and expectations. Some kind of command notes from our perspective, which is true in any tech rescue incident. Whoever the safety officer is needs to or should be, in our opinion, trained and certified to the level that the operation requires or higher. So if you're doing a technician level rope, trench, confined space, tower rescue, arborist rescue, whatever it is, whoever that safety officer is who's overseeing all this to determine if what you're doing is safe and within kind of your training and level of ability, they need to know what they're looking at. Unfortunately, in a lot of organizations, I shouldn't say unfortunately, but in a lot of organizations, the safety officer role is a predetermined person that may or may not have experience in all of the types of incidents that you may respond to. So an easy way around that is if you have a subject matter expert on scene, they can be assigned to work under the safety officer as an aide, as in that kind of advisory capacity to kind of bounce any questions off of that the safety officer might have. If you elect to have an operations officer, this would be the rescue boss. If the incident commander doesn't have a lot of familiarity, or if the incident is of such size or complexity that they're going to have other things to do as well, this person definitely needs to be trained and certified to the level that your operation requires or higher. Ultimately, this operations officer, the rescue boss, is going to work closely with command to develop your incident action plan. Part of this incident action plan development is doing a risk assessment. So we really like the Coast Guard GAR model, GAR. It stands for Green, Amber, Red. It's a very comprehensive risk assessment tool that looks at several domains of an incident. We're not going to get into it here, but it's something that's worthwhile looking up. When we talk about it, we don't advocate using it as it exists. Rather, it's a good way to get your team and your incident command staff to kind of look at all of these domains and talk about the risk that exists. So it looks at supervision. Does the incident commander, the rescue boss, the company officers, the team leaders have a little bit or a lot of supervisory experience? And not only their supervisory experience, but their supervisory experience in technical rescue incidents in this case. How much time for planning do you have? Have you pre-planned this? Is this something you train on all the time? Is this completely foreign to you? Right? The better pre-plans we have, the better training we have in advance, the more time we have on scene, obviously the better the operation potentially could go. Your team selection and your team fitness, and I'll talk about those both together. There's an expression, I believe it was Eisenhower, I could be wrong, but you don't go to war with the team you want. You go to war with the team you have. And basically what that means is that you could have all of your rock star rope technicians trained together all the time, the same group of 10 or 15 or 20. In reality, what happens is these calls come in when they're swapped off on overtime. They're never all together. So you end up having some really high performing people, some medium performing people, and a lot of people who have never had any exposure to this at all. So, low performance is not even the issue. It's just that it's completely foreign to them. So, knowing what resources you have on scene changes minute by minute, sometimes day by day, depending on, if you're on call, if you're on duty, if it's, strictly volunteer and you get who you get. So what rescuers you have and their level of ability changes often. So you need to kind of look at all of those pieces. And then team fitness. It's not just about physical fitness to do the job at hand. It's about mental fitness as well. Did they have a late night? Were they up all night on runs? Was there a bachelor party or a retirement party last night? Is their mind elsewhere because of personal issues? So you need to consider those things as well. The environment, right? Is it 5 o'clock at night and getting dark? Is it pouring rain? Is it in the middle of winter? Is it in the middle of summer and it's a million degrees with 110% humidity? All of those environmental factors, right, that affect our ability to operate. And then how complex is the rescue? Is just a worker that broke his arm and he can't operate his device and he's hanging there and you can lower him from the ground, or is it a worker 80 feet up that's pinned, badly injured, bleeding, conscious, and we have a rescue? So all of those things kind of are looked at in the GAR model. So from a command standpoint, I would just kind of encourage all of you to kind of think about those things when you talk about risk assessment, because all of those domains kind of play into the hazard level for us as rescuers. We have created an acronym for you to kind of help develop an incident action plan, ATLAST, ATLAST. And this is kind of our hierarchy of how we should attempt to rescue these people. So A stands for Arborist. So if you pull up to a job site that is a kind of highly tuned, high functioning ARB outfit that has backup climbers and a rescue plan, ideally, if there's another arborist there trained in aerial rescue, they will get their coworker down much, much faster than we ever will. So I would highly encourage you not to do what happens often is, we're the fire department, back up, we've got it from here. There was actually case law on this. I think it was Tacoma, Washington. An arborist was pinned and badly injured up in a tree. The fire department showed up, and there was another arborist there trained in aerial rescue who basically was begging and pleading the fire department to let him go rescue his friend. The incident commander did kind of, we're the fire department, back up, we can't let you do this. And ultimately, the victim in the tree died, and the family sued, kind of citing that there was a trained arborist on site who could effect this rescue. So I would highly encourage you to kind of utilize available resources if they're there, right? We're all very kind of smart, capable people. So very quickly, with a few quick questions, hey, what's your level of training? Are you trained in aerial rescue? What's your role? You should be able to determine if they're kind of vetted to do this kind of rescue. So if they're there, I would absolutely utilize those resources if you can. Second easiest one, right, is a ladder or a bucket truck. If they're right next to a roadway, you can park your aerial apparatus, swing up there, put them in the bucket, remove them. That's a home run. Next after that might be a ground ladder, right, if you can climb up real quick and help them down. But those two things, like we talked about in the beginning, we get like tunnel vision on, we have to use an aerial device or we have to use a ground ladder. So while we put them higher in the hierarchy than us ascending up to get a victim, you might very quickly kind of knock those two out of your mind and go, hey, that's just not efficient. It's not going to work well or quickly here. We're just going to go straight to ascending or hauling up a change of direction. So arborist on site, truck, bucket truck or ladder truck, ground ladder, us ascending up, and then S and T are stabilize and transport. So once we get up to them, we're talking about major life threats, right? Opening an airway, treat major bleeds, and then pick them off, get them down to the ground, and turn them over to EMS for definitive care. So if you can remember at last, when you respond to any of these, hopefully that helps you kind of get in the right direction. So rescue team selection. As we discussed, you will go to war with the team you have, not necessarily the team you want. So as an incident commander or other rescuers, when you're looking out at your options, right, you need to kind of recognize your own limitations. As an incident commander, you need to recognize the limitations of those with you. And the only way you know those if you train on this with some frequency to kind of understand where people's strengths and weaknesses are. Certainly, there are people who are very have a high strength to weight ratio, right? They're small and strong. They can ascend rope very quickly. There are bigger people that might be better off kind of building ground anchors and being a haul team, doing logistics support, stuff like that. And that's just the way this job works. So kind of understand those limitations, and it's very important as rescuers that we operate within the scope of our own abilities. So I'm not talking about a regulatory standpoint. I'm very much talking about trying to do something that you've never done before in training on a rescue. It's very unlikely that you're going to kind of rise to the level of your own expectations. You will always kind of fall back to the level of your training. That's something Nick Esposito from Truck Tactics talks about a lot, and it's something that we really appreciate that expression, and it's very, very true. Make sure you have the appropriate PPE when you're getting set up to go, right? So you got to be prepared for blood and body fluids if there's major trauma. So gloves, iPro or goggles. If there's kind of still machinery running that can't be shut off for whatever reason, hearing protection. Absolutely need a helmet, your Class 3 harness. And one of the biggest ones that we see, not just in ARB rescue, but in any tech rescue discipline, is self-rescue equipment. Far too often we see rescuers going over an edge, climbing up a tower, climbing up a tree, with nothing on their harness. At the very least, you should have a couple carabiners, a sling, a prusik, some kind of mechanical rope grab, some type of backup descent device that you're trained to use. So if something happens with your system, the team that's hauling you up or your climbing system gets fouled, that you need to be able to get yourself down. You absolutely should have a lanyard on you of some kind of work positioning lanyard, and that stuff is just for you. So if you need additional equipment to make artificial high points, if you're going to trail up a rope to set a fixed belay line to use with an ASAP, that's a separate set of equipment that's for the rescue, but you should always have kind of self-rescue equipment on you. If you haven't been trained on that yet, we're going to talk about it a lot in class. But there's lots of classes available, both ours and elsewhere in the kind of rescue training world. Self-rescue is a very, very integral part of vertical mobility. And then you have to have a backup team, obviously, that's outfitted in the same way and ready to go or assist if you need more manpower. So finally, after all of that other stuff, we're at the rescue phase. So patient access and rescue, right, using At Last for our incident action plan. As you're approaching the victim, especially at height, try to make voice contact before you're within arm's reach. Victims with altered mental status, either from hypoxia or blood loss, are very prone to acting erratically. Think about your diabetics, your drug overdoses, hypoxic patients that you've had before. They're hurt, they're scared, and they have kind of some kind of other thing going on due to poor perfusion in their brain. So you don't want them grabbing onto your stuff. So ideally, as you get close, trying to throw a lanyard on for yourself. So if they reach out and grab whatever your descent control device is, if you're using a prusik system, rad, that they can't kind of lower you or mess with your stuff. So again, we're going to try to stabilize the patient, only dealing with life threats, right? Airway compromise, major bleeding, and then work on getting them down. If you get up there and they're pinned, or you can't do it yourself for whatever reason and you need more help, then you might do a little bit more kind of care, and you can certainly kind of haul some extra medical equipment up, but bring kind of a little kit to treat major life threats. Maybe an oral airway. We talked about kind of bleeding control, hemostatic dressings, tourniquets, stuff like that. And then get them down as quickly as possible and turn them over to EMS for care and transport. And then finally, kind of the least fun phase of any rescue is kind of demobilization. So we're certainly going to do a PAR, and not like a structure fire PAR, but kind of check-ins, right, with all our rescuers. See if they need to go to rehab, make sure they're not hurt, kind of a mental health check-in. Depending on if it was a fatality or not, we might be leaving equipment. Ours, hopefully we can take with us, but all the Arborist equipment likely is going to stay. Might have to decon all our stuff. If law enforcement's not there, there's fatality, I would absolutely notify law enforcement, which is certainly a command level thing. If you're one of the techs, probably not your wheelhouse. But just kind of be aware that the scene probably needs to be kind of secured for investigations for any injury or fatality. OSHA may or may not respond depending on the nature and extent of the injury. So that's a phone call that needs to be made before you start kind of messing up the evidence too much. Depending on the type of call and the injury, as an incident commander, you might want to consider some type of grief counseling, CISD. Tailboard debriefs are huge. I'm a big proponent of them. It can be super informal, both to talk about kind of the mental trauma stuff for us if it was kind of a catastrophic injury, but also to kind of do the quick after action, right? What went well, what didn't go well, what's something we could do better next time, any personal takeaways that somebody might have. All of that stuff is very, very, very valuable in the long term, but is also fresh as soon as you finished it, right? When you do an after action, 48, 72 hours later, the next shift you come back, the next, training night at your volunteer house, some of the details get a little fuzzy. So if there's anything that's really critical to talk about that you noticed, either stuff that went very, very, very well, or stuff that didn't go so well, while it's fresh in your mind, doing a tailboard debrief is very, very important. And then we're going to terminate the incident and kind of turn it over to either OSHA or law enforcement if needed. Thank you very much for taking the time to watch this in advance of the program. You can reach us at Vector Rescue, info@vectorrescue.com, or on the web, vector-rescue.com. The QR code in the top left goes right to our website. Sean Emmons from Emmons Tree, who helped us develop this, can be reached sean@emmonstree.com. That QR code in the bottom right goes right to his website. If you have any questions that came up over this, like I said, please write them down. And on the final day of class, if there's any kind of lingering things, bring them up. If there's any kind of pressing things right when you get there day one, we're going to dedicate some time in the morning to kind of go over any big picture questions you had. Thanks, and we'll see you out there.